MoveOn has forums every couple months on issues that are in the national discourse. And this evening we're going to talk about single-payer health insurance. Our speaker is from Physicians for a National Health Program, the nation's leading advocacy group. Ann Sheets received her medical degree from the University of Illinois and is board certified in internal medicine, specializing in geriatrics, practicing in Chicago, except she recently retired to be a full-time volunteer for Physicians for a National Health Program. Ann, thank you for being with us tonight.
Thank you. I actually volunteer with two organizations. I volunteer with Physicians for a National Health Program and also for the Illinois Single Payer Coalition. I want to thank my colleague Susan Rogers, who's not here, who put the slide set together. This is the current situation in healthcare lends itself to cartoons. It has a couple back there. So this is a picture of the current healthcare system. It tries to be a picture of the current healthcare system. And down in the corner it asks, remind me why we didn't try single payer. So the United States healthcare system is by far the most expensive in the world. Yes, Bill?
Is it possible to turn on a few of those lights that are shining right on the screen?
Yes.
It's a little hard to see.
Okay. The United States healthcare system is by far the most expensive in the world, however you want to measure it. More than $2.7 trillion, over 18% of gross domestic product, more than $8,000 per person per year. And those figures are about double, or at least double, of the average in other industrialized countries. And yet, what do we get for that? Low life expectancy. The U.S. is over here on the left. High infant mortality. High maternal mortality. Low rates of immunization of children. Low rates of immunization of elderly people. So we have many challenges. We spend a lot of money, and we're not doing a good job by standard indices of health. So challenges that we have, first of all, access. In the United States, we have, at this point, more than 50 million people who do not have health insurance. Again, this doesn't happen in other industrialized countries. Our country is unique in this. Not only do we have uninsured people, we have underinsured people. This slide, excuse me, goes up to 2007. It's actually now, the calculation would be over 70 million people. There are various ways that you can measure underinsurance. If you take the measure that are you secure in the event that you get a serious chronic illness, then there's probably almost nobody who is not underinsured. You get a serious chronic illness and the chances are high that you're going to suffer financially from that. What happens if you're underinsured or uninsured? You're less likely to get primary care. You're more likely to die early. If you're a pregnant woman, you're less likely to get prenatal care. Poor birth outcomes. I mean, in an advanced, wealthy country, to think of our infants and our mothers dying, this is an outrage. That's the healthcare system we have. Medicare for all, what does that mean? So we have several terms for this. Single-payer healthcare, Medicare for all, we say expanded and approved Medicare for all. What does that mean? It means that everybody is automatically enrolled in the national program, from birth to death, every person who lives here. It's federally guaranteed, so it's a national program so that every single person in the nation is in it. It doesn't matter when you go from one state to another. It's not like you lose your health insurance. If you're insured in Massachusetts, you can go to Colorado and you still have the same health insurance. It's every resident of the United States, and what we say is, everybody in, nobody out. We also say, one nation, one health plan. So that's what I'm going to be talking about. I'm going to compare that, Medicare for all, with the Patient Protection and Affordable Care Act, which I'll call PPACA. So what does that do? It doesn't have automatic enrollment of everybody in the country in a national program. Instead, it mandates that people buy private health insurance. It also expands Medicaid eligibility. It subsidizes premiums for people below a certain level compared to the poverty level. And it has some insurance market reforms like guaranteed issue, no rescissions, but that's no rescissions for fraud, except for fraud. And the reason that insurance companies now rescind insurance most of the time is because they claim fraud. Does everybody know what rescission means? No. Okay. It means that the health insurance company, you've been paying your premiums, and the health insurance company says, this policy is invalid. We're not going to, you don't have any more benefits. And the usual reason they do that, they might do it because they say you have a pre-existing condition that we don't cover, so you're out. But the usual reason they do it is to accuse the beneficiary of fraud. So what they say is that you lied on your application. Well, it could be, what they call a lie is that you didn't report that you saw a doctor, in a famous example, for a yeast infection. Now you have a heart attack, and they say the fact that you had a yeast infection 30 years ago, you lied about that, so we're not going to cover you for a heart attack. I had this happen to my own patients. So that's what they do. So they can't have rescission except in instances of fraud, so what are they going to do? Go over your application with a fine-tooth comb and say you lied about something. No annual lifetime limits. Well, that's fine that you can still be covered after you spend $1 million, but in the meantime, you have co-pays and deductibles to pay. That's the problem. So, uninsured elderly, this is under different plans. The top line is, if we go on as we are now, and actually the 23 million is the estimate of the number of people who will remain uninsured when PPACA is fully operational. What about benefits? There are two ways to think about benefits of health insurance. So one is, what kinds of services are covered? So that means, are drugs covered or not? Are doctor's visits covered or not? Primary care versus subspecialty care. Is dental care covered? Is long-term care covered? Mental health benefits. So these are some of the benefits that might or might not be covered under specific health insurance policies. And then there's financial coverage. How much of the cost of your care is going to be covered, and how much do you have to pay out of pocket? So under Medicare for All, what we are working for is all necessary medical care will be covered. So that means preventive services, care if you're sick, care if you're pregnant, care for neonates, medications, mental health services at parity with all other medical care. You may or may not know that nowadays mental health care may not be covered at all, or if it's covered, it may be covered at only 50% of what other kinds of medical care are covered. Dental care, almost nobody gets dental care covered. Yes, sir?
Excuse me, quick question. How do you determine what's medically necessary?
Okay. We already have a pattern for this because Medicare does that. So it's an assessment of what are the benefits of this compared to the side effects. Is it something that saves lives, prolongs life, something that decreases morbidity? And then we say, and what are the side effects of it? Because there are some things that work well for a certain condition, and yet they have severe side effects. So that's how you balance it. You have to, and we say that whatever kinds of medicine you talk about, whether it's under what's now called standard medicine or it's alternative medicines, we want the same standards. It has to be evidence-based, that this is beneficial, and that whatever harm it might cause is less than the good it's going to do. So. Oh, and we also say these services should be covered at 100%, first dollar coverage. Why do we say that? Because if you don't have first dollar coverage, then people don't go for it, even if it's needed. We have evidence for that. Okay, PPACA, no standard benefit package, and really not a way to determine it, not a scientifically sound way to determine it. So all insurance plans do have to cover certain benefits, primarily preventive services. Well, this is good, but what about when you're sick? And everybody gets sick eventually. Everybody dies, therefore everybody gets sick. Unless you're a person who never used any medical services, and then one day you drop dead of a heart attack. But we're not encouraging that. That's not what we want, you know? We want people to, if they're going to have heart trouble, we want them to have it when we can still treat it and make it better.